So I'm talking today about just basic fillings. Many of our patients come to us just for simple fillings and what your choices are. And we have about 7 different types of filling materials, and so it can get quite daunting. But I'm going to talk about the major 2. And now what fillings do is that when a tooth has a cavity or decay that has reached a certain point where it's going to invade the tooth and cause an infection, a dentist is forced to remove that decay part and put a filling in. And that filling replaces the natural tooth structure. And it can be done with many materials. And the most common one today is something we call composite. And composite is a mixture of resin or plastic with porcelain beads. So it's tooth colored. This is what most people call the white fillings. We like to call them tooth colored because we shade them to match your existing teeth. They're beautiful, and the technology in the 30 years that I've been doing has expanded to the point of where they're fabulous. 30 years ago, they had some issues, and they've gotten, so these are also known as bonded fillings, or a fancy word for saying glued-in fillings. Wonderful choice. They offer a lot. We do offer as another choice, though, are the old school fillings that many people aren't doing anymore, and those are called silver amalgam. And the big advantage of these is that they're a little less expensive. And for people who are looking for, they're a wonderful filling. They are very safe. They last a very good long time. And for many people, these could be a safe economy option, something that saves a little money. Of course, we offer some of the high-end versions, which are gold inlays and onlays. Probably if somebody said, what is the best filling there is, there's no question gold is the way to go. But they can cost thousands of dollars because of the price of gold. So they're not done as much anymore, but they are a beautiful filling material. There are all porcelain fillings, and that maybe let's be a little clear about that there's these composites which have resins, but there is this tooth-colored filling that is made in a laboratory that's 100% porcelain or glass. Its big advantages, it's slightly more cosmetic and longer lasting. And probably I would throw in the final type of restoration is we can do a combination of these. But these are the choices they all work great, and they can all offer you a long-lasting, beautiful restoration, and it all depends on what you need. I always want to emphasize, for any of you that are interested, we do free consultations. You simply come in and you and I talk. It's not necessarily if you have just particular questions. Of course, if you would like services we provide, that's extra. But if you want to just come in and talk about your situation, what we can do for you, it is always free.